House District 6 arguably has more coastline than any other in the state, and I'll say it is the best district in the state. But I've got a lot of Bay County, all of Gulf County, and a piece of Franklin County. As in healthcare circles, each county has their own Department of Health, and they run with three totally different missions, and you try to, hopefully see that the public health issues are being addressed. But at the same time, you also have emerging hospitals, established hospitals in this, and these hospitals have to work together with each other. Apalachicola with Weems Hospital, which is owned by the county. Franklin in Gulf County, there's a new Sacred Heart Hospital that's under construction. So that'll be a hospital that Gulf County has not had since their last hospital, Gulf Pines, had closed down. And then you come to Bay County, and we have a presence of Bay Medical Center and also Gulf Coast Hospital. All of the hospitals, I think, work very well together, and as we try to treat the urgent care needs and healthcare needs of District 6, I think it's a good, healthy mix. Now, in the scheme of things, Gulf Coast and Bay Med are the largest hospitals between arguably Fort Walton Beach and Tallahassee. So you can imagine how many of the rural counties that may have smaller hospitals that service, but at the end of the day, the heavy lifting that takes place with cardiac care and neonatal needs and on all those issues will then gravitate towards the hospitals that have the ability to have the higher capacity, the higher traffic in order to fund and maintain those specialty units. Neonatal needs are, to me, a huge issue because I just became a dad. I've got a son who's 9 months old, born at Gulf Coast Hospital, and to be able to be in the room with my wife to see my first son born was an experience I'll never forget. But I think it also kind of carries on as now my impression of the role of hospitals in our community, because here's a gift of life of what I think will probably be the greatest investment that I'll ever have. Anyhow, Gulf Coast played an incredibly important role to me in that, and didn't mean to get emotional there, but it was a great experience, and I'll treasure that. Health Reg, we had approximately 80 various pieces of legislation that were assigned to us this year. And all those legislation dynamic and innovative, and as a citizen initiative legislative process and citizen legislators got all types of ideas, some good, some of them were huge fiscal impacts, and in a year with tight budget means sometimes this isn't the best time to try to find a way to raise taxes in order to implement a new idea or concept. So we try to just probably move forward a little more of what status quo, tighten our belt as best we could. But some of the policies and even one of the a little bit innovative, a little more controversial, but is I'll take for example is Dr. Renuart, who's also a House member. His House Bill 1033. 1033 essentially would take an ambulance, EMT, reports to somebody's home, has chest pains, potential cardiac failure, or cardiac arrest, and then lets that EMT say, you know what, we need to make sure we take them to a hospital that has a special cardiac unit. Now, in some means, this could be a challenge for some hospitals. If you got multiple hospitals in an area, and one has a cath lab or a cardiac lab and the other one doesn't, then you can see the turmoil this might rise. But at the same time, as they fight for market share, but at the same time, then we also have the opinion that we need to make sure that we're doing everything we can to save people's lives. And if that means taking somebody with cardiac failure to a hospital that specializes in that, their likelihood of surviving it might increase. But for the most part, all of our ERs are fully capable of stabilizing anybody who has had a heart attack. So kind of a matter of opinion, a little bit of a debate, but I think that's a healthy part of the process is bringing up those type of legislative ideas, have them heard out, and you get groups. The hospital association gets involved. You have EMTs get involved, firefighters, policemen, heart association, and then you have the physicians. So, I mean, a bill like this, whether or not it actually passes the legislature, I think it's good for spirited debate and to kind of vent some of those policies and concerns and even question if we're doing the right thing.
Will you tell us a little bit about House Bill 285, which is reforming the LIP Council?
House Bill 285 originally started off as a way to change transparency in our hospital's FMAP money. We currently right now have a LIP council in place, a 17-member council made up of hospital administrators, government officials, and they make a series of recommendations back to the state. From time to time, I think the legislature looks at this enormously large appropriation that this council has authorizing opinion over. Maybe we could use a little more transparency to it. Maybe allow the healthcare dollars to follow the encounter data, to follow the patient. So as sometimes the challenges that a council has come into consensus, which this one does, it has some challenges from time to time come into consensus, how that money is spread up between the various hospitals serving indigent care and bad debt and charity care in the state. The LIP Council bill, the House Bill 285, was then put into motion. And as any piece of legislation in this process, it's an open process of democracy. We move forward and we take in other legislators' concerns, other amendments, other issues that might rise to the surface of changing the status quo. As the LIP Council bill had moved forward, as House Bill 285 moved forward, we came up with a variation and really trying to remove, at least in my opinion, the Tallahassee insiders off the bill. And what I mean by that is I felt like the Florida legislature needed to have a presentation of a summary from the LIP Council without paid lobbyists on the council. Felt like it was fairly simple. The bill that is as currently amended essentially does that. We'll get some of the paid lobbyists, that whether they represent specific hospital systems or if they represent counties or cities or special taxing districts, will not allow to serve on there. And we've also expanded it. We felt like it was important to put medical professionals on the LIP Council and targeted even those surgeons and doctors who take call in AER. That is probably the first line of defense of where admins come, or the ability to know whether or not this individual is going to be a charity case or whatnot, just to kind of get really up to their elbows and really the nitty gritty of what our hospitals deal with day in and day out. So there's doctors that'll be appointed to the LIP Council. We also have asked for ACA to serve as a non-voting chairperson, be Secretary of ACA or somebody that he or she wants to appoint. We also would like to put a member from the FQHC on there. FQHCs are federally qualified health centers. They do a different mission with primary care, take up a number of issues that can be at least diverted out of our emergency rooms. So we feel like they're an integral part. And then lastly, a member from the Department of Health. The LIP Council will grow in essence to 24 members, and as its rest of its existence for the next I guess 10, 12 months, 14 months in play with implementing the law, that'll be the new makeup of the LIP Council. Day in and day out, whenever there's a constituent that comes to Tallahassee, I always usually pretty wrap up my conversation with them and point out that they are reality, and sometimes Tallahassee's fantasy land. We try to do what's right for the people up here, but from time to time the people need to come in and have their opinions heard. I'm not a healthcare professional by trade. I come from the restaurant business, but I come from small business. I come from a family-operated business that day in and day out, it's going to open, it's going to do business, and whether my employees show up or not, we'll find a way to make do and make it happen. This process is no different. The legislature will continue to meet in good times and in bad, and I think it's good to have a healthy cross-section of various businesses, various fields, various educations, various income levels to make this process a sane one and try to bring as much reality from the outside to it. But I can't say enough praise about groups that decide to organize, that decide to say, enough's enough. We want to make sure that the process is paying attention to good government policies. And, groups like this, I think, are good ones. In addition, there are a host of others that come together and rally around their agenda and their mission to make sure that they're the watchdog to make their policies heard through this legislative process that we meet once every year with.